Can you introduce yourself a little bit?
Hi, my name's Merissa Ferrar, and I'm a second-year dental student at UCSF School of Dentistry.
Okay.
I did a summer research fellowship where I was bridging the gap between micro-X-ray computed tomography and clinical X-ray CT machines. There's a large gap because of the in vivo versus ex vivo capacities of the machines, as well as the resolving capacity, meaning really, really high resolution versus low resolution, not a lot of information. So by bridging this gap, we're hoping to be able to identify early ectopic calcifications as well as bone loss within the human body, and stuff like kidney stones, salivary stones, and aortic plaque as well. So what we did to bridge this gap was we created a phantom. A phantom is a known standard of mineral density in a gradient. And it had a small inner rod and a large outer cylinder that fit together or could be image separate. The small phantom was able to be fit in the Micro-XCT with a very small field of view, and then they were scanned separately in the patient care. We created a calibration curve that allowed us to convert from Hounsfield units, which is the current level of measurement, to mineral density. The importance of that being that a mineral density measurement is much more accurate and will tell you about quality rather than just an abstract number of what's going on with the image. So the quality of bone and knowing the mineralization will give us information when it comes to implant survival, as well as periodontitis, and being able to investigate into calcifications in the body. So to take my research further, we studied a human mandible that I acquired from the morgue. I took this mandible, I scanned it in the clinical CT, and then I took this tooth here that you see on my 3D printed specimen, and I scanned it in the Micro-CT. You can see the big difference, as well as that you can identify calculus or calcified plaque below the gingiva. And then we did the same for a kidney with the aorta, and we're able to take a sample and scan that in the Micro-CT, and then compare the Hounsfield units to mineral density. The mineral density was much more accurate on the Micro-CT, whereas with the patient care, it was way off. So what we're showing is that the systems we're currently using in clinical care are not as accurate as they need to be, and if we can improve that accuracy, we can detect early disease and offer better treatments for patients. So the next step I want to take is incorporating the dental cone beam CT technology. It took us a while to gain access to having this clinic wanting to work with us, but we're hoping that when we are able to incorporate the CBCT, we can convert grayscale to mineral density. And to make this exciting for all the students involved, I took my specimen, I converted the file from DICOM to OBJ, 3D printed my specimen, and then I turned it into a virtual reality experience. I borrowed this VR headset from School of Medicine 3D Anatomy Lab, made the file myself, and you can actually wear the headset and see my specimen in virtual reality, teleport around, and put your head within the bone and see all of the alveolar bone versus the mineralization of the teeth and how it differs. So I want it to be fun and get students excited about radiology as well as research that's going on in this field, because this is the new known standard when you have any sort of disease that wants to be investigated, is take a CT scan, go further. Also, we're hoping with this correction factor we determine we can do low range microsieverts, have less radiation exposure, and be able to have better resolving images for patients. So I'm really hoping that this research can be expanded and help patients here at UCSF, as well as by reducing radiation standards but offering more pathologic identifications.
Can you briefly describe, just and summarize that people on the street can understand what you're doing?
So basically, we're trying to improve CT technology.
What is a CT technology?
CT technology is a CAT scan. So when you go in and you have the CAT scan taken of all the slices of those little pictures, it's actually a 3D image. So what you do is you take many pictures and then you form them together to make a 3D image. So right now the technology is very old, from the 80s. We're hoping that we want to improve this and maybe have companies be able to improve their technology, because it's a very important diagnostic tool that we use in medicine as well as dentistry.
What about cost-wise? Will it be cheaper or expensive?
So right now, it's actually not that expensive to do the CT scans. The issue is radiation dose. So CBCT has lower radiation dose than patient care, and Micro-CT has very high radiation dose. So this can't be used on humans, it'll kill you. But if we can use this technology to improve this technology, then we can get more information out of that same amount of radiation, so we can offer better technology at the same cost to patients.
Question for you, what got you interested in this study?
So my interest in this study started because I was an art major in undergrad, and then I actually trained as a medical artist, where I work as UCSF as something called an anaplastologist. I make hyperreal facial prosthetics for patients, including eyes, ears, noses, and dentures. My goal is to become a maxillofacial prosthodontist, which is a dentist who specializes in working with head and neck cancer patients and being able to provide restorative dentistry to people who've lost parts of their body due to cancer and other effects like traumatic car accidents or birth defects. So this is my background and how I love working with technology as well as imaging and making things accessible for patients, because I've worked as a clinician, and now that I'm a student, I'm really interested in being involved in research to see how I can use this to help my patients in the future.
So what kind of schooling did you have to have in order to be where you're at today?
So my schooling, my background was an art degree from the University of Pittsburgh. After that, I worked in the dental field for a couple years as a treatment coordinator and office manager. After that, I did a 2-year anaplastology fellowship through the Bronx VA Hospital and Columbia Dental School. That's where I learned how to make facial prosthetics and work with patients. I'm actually board eligible and hoping to get my board certification this year in the field. And that is what inspired me to apply to dental school. So I had to go back to school, study science, apply to dental school, and then after dental school, I'll have to do a 3-year specialty training in prosthodontics, which I'm hoping to do here in San Francisco, maybe at the VA hospital, because I love working with veterans. And after that, a 1-year fellowship again in maxillofacial prosthodontics to be at my career. So
you love what you're doing?
I love what I do. I love working with patients, and I find that in hospital settings and academia is where I'm able to treat the most medically compromised patients and use my talents and my skills to help the most people. So,
well, thank you so much.
You're
amazing.
welcome.
Thank you. And you are, what